the average weight loss on tirzepatide is about 25% of your total body weight, which is very comparable to surgery.
I underestimated how much you knew about this. I'm sorry. When someone's wanting to start somewhere, where do you recommend they start?
So,
Welcome back to the New School OB-GYN YouTube channel again. We have Dr. Mercado
hi.
with us on a different day, not the same day.
Same clothing, though.
Same clothing. My wardrobe is not very diverse. And I was told I should wear blue pants with my shirt instead, which would match the blue on there. But anyway, we're talking about obesity medicine again, diving into the different medication treatment options. So we did the discovery on the first episode where we talked about, how does someone know if they're obese and what the effects have on a person's body with obesity and extra adipose tissue. And so watch that episode first if you did not see that one. But today we're going to be mainly talking about maybe touch on, diet, lifestyle, and then go to the medication treatment options that you prescribe in your clinic for patients. And then, when should somebody potentially seek surgical options?
Okay.
And again, why I have Dr. Mercado here is she has not only a board certification in OB-GYN and works with me there, but she also has a board certification in obesity medicine and also certification for menopause care. And I think we'll talk about that in the future. All right, Dr. Mercado.
Right.
So we got through all of how obesity can affect a woman's health and body. And now I want to talk about, well, if someone's discovered they want to make a change, and how they would go about doing that. And I think there's a very saturated field of social media health wellness advisors or diet plans, or you got to do this and you can lose 30 pounds in 30 days, or
Yeah.
we're not going to do anything flashy here.
No flashiness.
Flashiness is bad, but it gets people to spend their money on their product. And so when someone's wanting to start somewhere, where do you recommend they start?
So the lifestyle changes that have been shown clinical trials in the long run to help people lose weight and keep it off are, simple and basic, straightforward, right?
Yeah.
We don't need to reinvent the wheel. I mean, again, like I said in our previous episode, if you have money to spend on XYZ supplement, be my guest, they're not necessary, right?
Yeah.
So number one is a balanced diet, right? And when it comes to obesity and people being metabolically unhealthy, the diet that has actually been shown to help people be a little healthier is the Mediterranean style diet, right? Having said that, the most important thing while on a weight loss journey is to prioritize protein intake and fiber intake. And in the long run, when you compare diets, whether they're like low carb or low fat, keto or Atkins or whatever you want to call it, or like low fat, high carbs, basically what the graphs show is that initially people on a low carb diet do lose slightly more weight initially. But if you see everybody at the end of the graph in a year and a half, everybody ends up at the same place. So in the long run, whether you do low carb, low fat, low carb versus low fat, you will, in the long run, lose more or less the same amount of weight, right? What matters is that you stay within your caloric deficit, right? So prioritize protein, fiber, the amount of carbs and fat at the end of the day don't really matter. You do what's best for you. Right? You do what is sustainable for you, which is what matters, something you can sustain in the long run, right?
Because it's not a sprint. It's not even a marathon.
Sprint, not even a marathon.
It's an ultra.
It's an ultra 200-mile race.
It's the rest of your life.
Yes.
And so you have to have something that's sustainable. So I think we always want the quick fix, or the juice cleanse or something like that, because I lost 10 pounds on a juice cleanse. Well, it's because you just drank juice for that time, and you can't do that for the rest of your life. And so breaking that down a little bit further, in someone discovering, I think personal story, like within the last 6 months or a year, I kind of went down this journey myself, and I found out, even though I'm a medical practitioner, I found out a lot of information about foods just by downloading a free app, tracking what I'm eating,
Yeah.
truly seeing how much protein, how much fiber is in it, and keeping track of that. And there's a number of free apps out there where you can, track your macros or something
Yes.
like
Yes.
that. Do you have any specific ones you like, or?
I've always used my entire life. I've always used one called Lose It. It's like an orange scale is
Mm-hmm.
the icon, and just because I found it more like user friendly than, but
Yeah.
most people also like to use MyFitnessPal.
MyFitnessPal, I've
Yeah,
used Chronometer. And again, it honestly doesn't matter which
yeah,
one you
it doesn't
use.
matter.
It's consistency.
Yeah, and I think if you, I know it's time consuming and it may be a little, overwhelming initially, but if you track your food for a certain amount of time, you will learn and then you will know more or less what does a, 30 gram of protein look
Right.
like and what does 2 tablespoons of fat look like,
Right.
so
And being honest with yourself, and again, you don't have to do this every single day for the rest of your life, but
yeah,
that amount that
learning.
you're going to learn just by doing this, just by being honest with yourself and plugging in everything you
Yeah.
eat in a given day, you're going to find a lot out.
Yes, yes.
And
I think it's helpful as long as it's not gonna backfire, mentally. If you, we always ask this question: if you're gonna be like obsessive and it's gonna consume your
yeah,
life, maybe not start there.
sure.
But
Yeah,
I think it's a good idea and a great learning experience,
yeah,
so that you understand, what foods
yeah.
are, better quality and better for you in this weight loss journey.
Because the stuff that's generally bad for us or the addicting stuff is just so easy to get your hands on
Yeah,
and so easy to eat more than we intend to. Um, and so that is a good place to start. I think we grew up probably in the era where it was like, if you want to lose weight, you gotta go run 20 miles every day. And maybe that isn't the correct, but movement
yeah,
and strength training
yes.
is very important to
Yes,
all of this.
they're both very important. And for weight training, the recommendation is at least 2 sessions a week. And by weight training and resistance training, we mean anything that will challenge your muscles,
Yeah.
right? If you're doing some sort of resistance training or weight training and you're not feeling it, that's not good enough, right? You have
Yep.
to
Yep.
you have to train your muscles almost to failure,
Yep.
right?
And yeah, and this doesn't even necessarily mean going to the gym because that's intimidating
Yeah,
um, for a lot of beginners, people in the working out realm, or it's just inconvenient.
yeah,
It could be something at home,
yeah,
um, and there's infinite number of um, fitness channels out there that
yeah,
we could refer to, but
yeah.
the
They're
important part is starting
starting.
and then getting the weight and the
Yeah.
resistance to.
And like for most of us starting out, weight based like how do I say this? Without dumbbells or without machines, just like weight based, like
Body
your
weight.
own body weight
Yeah.
exercises. I mean, doing 20 squats can be hard and challenging, and that will challenge your muscles to start with, or like trying
Hmm.
to do a push up.
Yeah.
Right now, I cannot do a push up on the floor. I have to do it
Yeah.
on the bench.
Yeah.
So
And the important part is just doing it and challenging yourself, and starting.
yeah, starting. And I think we all get caught up also on this idea of perfection, right? We need to go to the gym, or we need to have this equipment at home, or
Hmm.
we need, oh, I don't have 30 minutes, but you know what?
Hmm.
You have 10 minutes,
Hmm.
right? You can do a few sets of quads and lunges in 10 minutes, and that can be challenging.
I think it's easy to make barriers
Yes.
or invisible barriers to try and, because it's hard to get into that consistency and that, you know, wanting to take care of your body and yourself for the future. And the resistance training and other has a lot of other positive effects in the body,
Yes.
especially a woman's body as they're going through or potentially getting to the point of 30s, 40s, 50s, setting themselves up for
Success later on.
success later on, which I think we'll talk about in the future
Yeah.
again.
Yeah.
Okay, someone's doing all of that. They're
Oh.
starting, their journey, and they're seeing you, and they're, I'm doing this. I'm not exactly seeing the results that I want, and I want to see the results quicker, or I'm basically what I'm saying is, I want to start a
Yes.
medication.
Yeah, they want to start medication, which I mean, they're not All of these things are not mutually exclusive, right? You can start lifestyle changes with medication at the
Mm-hmm.
same time, right?
Mm-hmm.
And sometimes you need some, I see patients that are very heavy, right? They can barely move. I
Mm-hmm.
cannot expect that person to go walk 3 miles.
Mm-hmm.
Sometimes they may need to lose a little more weight before they can actually start moving a
Mm-hmm.
little more, right? So it can all be done at the same time. Some medications, in general, our go-to are the very famous GLP-1s,
Mm-hmm.
most commonly known as Ozempic,
Oh, you want to
right?
talk about Ozempic right
Yeah.
away?
No, but we see a lot of patients that come to us, and sometimes, these medications is sometimes not always covered by your insurance, and they can be very expensive. You know, there are ways around it, but I think it's important to put the point out there that they're not the only treatment, right? And if you are unable to afford a GLP-1 or your insurance doesn't cover it, don't be discouraged. There are other options that they can actually work very well. So in the non-GLP-1 world, we have two medications that would be the next best thing after a GLP-1. And it's a combination of an amphetamine called phentermine
Mm-hmm.
that a lot of people remember from the fen back in the day. It was one of the fens
Yeah.
on it. Phentermine has
What?
been around for over 30 years, probably even longer, probably
Mm-hmm.
since I think the 1960s.
Mm-hmm.
We have a lot of long term data on phentermine. It's very safe.
Mm-hmm.
Um, it is only FDA approved for a 3 month use, but there is long term data that is safe, that is pretty safe,
Mm-hmm.
even in long term use. So after those 3 months, so we use it off label
Okay.
for over 3 months of treatment. And phentermine, with or without another medication called topiramate, they're both very effective.
Mm-hmm.
These two actually come together in a pill called Kisimia. Average weight loss on Kisimia is about 10%, can be about 10% of your total body weight, your starting total body weight. And to put that into perspective, the weight loss with GLP-1s are between a 15 and 25%,
Okay.
right? So it's not obviously a GLP-1, but it's not low, right? It can be a very effective treatment.
10%, for
Yeah,
example, of 250 pounds is 25 pounds.
25 pounds.
Yeah.
Yeah.
Is that over a given time?
So, yeah, all of these percentages are over a 12-month use.
Okay.
Okay. And then there is another medication that is also a combo pill called Contrave or Contrave. And it is a combination of Wellbutrin or bupropion, which is a known
Mm-hmm.
antidepressant, and also another uh, medication called naltrexone
Mm-hmm.
that can be known as Narcan,
Mm-hmm.
an injection. But basically, these two medications work in your dopamine system, so they stabilize your dopamine levels, so you have less desire to eat, less cravings. You
Mm-hmm.
reach out for those snacks a little less,
Mm-hmm.
right? The phentermine and topiramate combo are more appetite suppressants,
Mm-hmm.
so it can help people eat less and also, have less cravings, reach out for
Okay.
food a lot less. So there are other options out there. Sometimes we use off-label metformin
Mm-hmm.
to help these regimens, just to help you metabolically. We can add metformin to any
Mm-hmm.
of these regimens if we think we need to.
And we see that a lot with our patients with
PCOS,
PCOS.
yeah.
And so could further enhance some, in
Yeah,
fact, insulin sensitivity
yes,
and those things. And so so I'm recapping it, okay.
yeah,
Obviously the big one out there right now is the GLP-1 medications.
yeah,
Um, but there are other two good categories which you're discussing that, and again, I think we'll talk about this in a second, is like if someone's coming to you and
yeah,
money isn't an issue, which one do you see have the least amount of side effects? Maybe start that first. But first category is appetite suppressants,
yes.
which would be the phentermine and the
Topiramate,
topiramax or
yeah.
topirmate, right?
Topiramate, Topamax,
Yeah.
yeah.
Um, and big side effects with that one, you notice? It is more of a
Yeah.
stimulant,
It's so topiramate is not a stimulant. Phentermine is a stimulant.
yeah.
So obviously, a stimulant you have to take it early in the morning. You cannot take topiramate at 5 p.m.
So
because you won't
potential
sleep.
sleep disturbances
Sleep
with it, yeah.
disturbances. Some people may feel a little jittery initially, or like your heart is racing, but that tends to subside pretty quickly.
Okay.
And in long-term studies, phentermine has been shown to increase your heartbeat by like 1 to 2%. It's like
Okay.
negligible,
Right.
And in the long term, also studies have not shown to actually increase blood pressure.
Okay.
So it can initially increase your blood pressure, but not in the long run. It is something that your body will adjust to.
And let's say somebody does the phentermine Topamax combination for 6 months to a year, has good results, but they want to come off the medication. Do they rebound usually, or is it just?
So when it comes to, this is not unique to topiramate and phentermine. So any treatment you do for weight loss, and this is when we touch initially that you can start lifestyle changes with medication. Medications usually make it easier on a patient to start those lifestyle changes, right? And a lot of it has to do with practice and habit, right? Whether you learn to not reach for that extra snack that maybe you don't need that day, right? And then it becomes a habit, and then you learn things about yourself because while you use the medication, you're more in control, and then you can practice, right? So regardless of which medication you use, if you are going to come off of it, first of all, very important, if you stop a medication like cold turkey, most people will regain the weight. About 80% of patients will regain the weight, sometimes even a little more, regardless of which medication they use, right? So I always tell my patients, losing weight is one thing. Then we have to maintain and learn to keep it off, and then wean off the medication, right? So this is, like you mentioned initially, is not a sprint.
Yeah.
Not a marathon, even more than an ultra marathon. This, you have to be committed to do this for the rest of your life, because as you wean off medications very, very slowly, we have to make sure those lifestyle changes are there.
Yep.
Because that's what's going to help you keep the weight off if you want to wean off medication. Some people may not want to wean off medication, but
Yeah.
that's a different story. Yeah.
Yeah. And so and then we talked about the Wellbutrin and which was a combination
Naltrexone.
with naltrexone.
Yes.
And naltrexone, we know that as Narcan because that is what's given to somebody who might need, if they're
Opioid.
taking opiate drug medications, and we want to reverse that, we give the naltrexone. But those opiates work on the dopamine receptors, and so you
Yes.
can see how that works, because also, foods, things like that, you have a dopamine surge with tasty
Yes.
foods.
So they're FDA approved for weight loss and in the setting of binge eating disorder. And, there's a long-acting Narcan, long-acting naltrexone injection that's used for alcoholism. Wellbutrin is used to help people also stop smoking. So it's used in different settings with behaviors that can be addictive.
And food is
Yeah.
an addictive thing.
It is.
And then the GLP medications, which would be like and are they kind of their own category? We mentioned the suppressants and the
Dopamine stabilizers.
okay.
Yeah.
Yeah.
So GLP-1s, they're, we call it GLP-1s, they're a family of medications. The first one was developed a little over 20 years ago by now. It was imagine this, twice a day injection.
Oh.
And then there was a second generation that was developed that's a once a day injection. We still sometimes use it. And they are not new in the medical world. They've been, like I said, around for over 20 years in the world of diabetes. They are new for weight loss, or newer for weight loss, right?
Okay.
So after the once a day injection, then the once a week injection came out. That was the first one that came out, was Ozempic, right? And then Ozempic, the molecule, it's called semaglutide, right? And it is just a GLP-1 glucagon-like peptide. And it has multiple effects. We can go into that later. And then the semaglutide molecule was approved for weight loss under the name of Wegovy. They're both the exact same molecule. The dosing of Wegovy is a little different than the dosing of Ozempic once you get to the higher doses, but they're both semaglutide.
Okay.
They're both made by Novo Nordisk, and they're both just a GLP-1 molecule. And then in 2022, we had Mounjaro and Zepbound come out. These are made by Eli Lilly. Their molecule is tirzepatide. And again, the names, the reason why they have different names is because one is approved for diabetes, the other one is approved for weight loss. So Mounjaro is the diabetes, Zepbound is the weight loss one.
Okay.
So this molecule, tirzepatide, has two peptides, has GLP-1 and GIP, gastrointestinal peptide. So as time has gone by, there have been clinical trials have shown multiple benefits of GLP-1s, not only weight loss, and some of them independent of weight loss. So how they work for weight loss, they have some degree of appetite suppression, but their main effect is to tell you that you're full. So you get full, you got that fullness, satiety sensation with less amount of food, kind of telling your brain, oh, you're full, stop eating, right? So, and they also slow your gastric emptying. So they slow your digestion. That's where most of the side effect comes from. Gastrointestinal side effects like nausea, indigestion, burping, reflux, constipation, things like that. But they have also been FDA approved for other comorbidities, all of them associated with obesity. So, for example, Zepbound is also FDA approved for sleep apnea. Ozempic is FDA approved for kidney disease on patients with diabetes also. Wegovy is approved to decrease the risk of adverse cardiovascular events on patients with already heart disease. And it just recently got approved for patients with fatty liver.
Wow.
Yeah, so that we can see also there are multiple benefits, and there are GLP-1 receptors all over our body.
Yeah.
They have been studied also they're being studied now for addiction medicine, also for some like rheumatological diseases, like pro-inflammatory diseases, because people tend to get better, independent of weight loss. So they have multiple benefits. They are our go-to medications if a patient can afford it, or we can try to get it covered by insurance.
Okay. Wow.
Yeah.
I underestimated how much you knew about this. I'm sorry.
I know a little bit.
Yeah. So, okay, that was a lot of information, a lot of different medications, which people maybe didn't even realize. I didn't
Yeah.
even realize there were so many GLP medications.
Yeah.
And I guess big question is, why is it still so hard if there's these FDA indications for, it seemed like Ozempic was hard to get because that was indicated for
Diabetes,
diabetes, and these other ones have these other indications, medical related. Weight loss, you mentioned for I'm forgetting the names, the ones that are indicated specifically for weight loss, but why is it just insurance? It's just being stubborn with
yeah.
paying for the new things?
So, unfortunately, there are a very big distinction is being FDA approved does not mean an insurance will cover it. Your insurance company will cover it, right? So we have to have that distinction. And a lot of times we can appeal it and fight it. It doesn't always work, but a lot of the times it can work.
Yeah.
Right? So it's also part of it is also doing the work to try to get it approved. But the main roadblock is cost, right? So for some reason the retail price is pretty high. It's about $1,000 a month.
Wow.
And a lot of the cost, to my understanding, has to do with the way the medication is delivered, because it's a one-time dose pen.
Mm-hmm.
So
It's not very efficient. It's costly.
yeah, so that I'm aware, part of the cost has to do with the mode of delivery with that pen.
Okay.
Well,
hopefully with the decrease in the amount of other comorbidities, maybe insurance can eventually change their mind. But
and another thing also that they're FDA approved, like I mentioned, for kidney disease, heart disease, fatty liver. There is specific sleep apnea also. There is specific criteria. So it's not anybody with sleep apnea. You have to have a certain HI index above, or you need a FibroScan for the fatty liver, and it has to show XYZ. So
very particular.
It's very particular.
Okay.
Yeah.
Is this, and kind of to segue,
Yeah.
is this part of the reason? I mean, we have all these new tools now to help fight obesity and get someone's body fat percentage down. But is this part of the reason why people are still choosing to head towards the surgical route, would you say? Or at what point would you refer somebody to a bariatric surgeon or center to consider surgery?
So usually for bariatric surgery, you have to qualify. You have to be above a certain BMI. That's usually above 35.
Okay.
So anybody below that won't qualify because there are risks with surgeries, and they will change the way you eat for the rest of your life to a certain degree, right? So it's not just get surgery and done. Nowadays, also, the average weight loss on tirzepatide is about 25% of your total body weight, which is very comparable to surgery.
Okay.
So, you also have to put that into perspective. Having said that, if someone has a lot of weight to lose, you may want to consider surgery, or if someone already has a lot of weight to lose, they have been on the GLP-1, the medication can only get you so far. Also, you may want to also consider adding surgical treatment to that person. Some patients need to lose weight faster for XYZ reason, and usually surgery, initially you will lose a lot more weight faster than with a GLP-1. Again, these percentages that I mentioned are in a 12-month use, right? So,
Okay.
they're different. Or if someone is unable to, afford a GLP-1, or insurance doesn't cover it and they really need to lose weight, I'm not going to delay further treatment. They should go to a bariatric surgery consult. And again, it doesn't mean they're not using, we can start them on other medications, but if you really need it,
So there's not a ton of strict criteria of, if someone is wanting to start their weight loss journey and they need a more aggressive start. Medicine is still a very good option.
Yes.
Surgery is an option, but
Yes.
it's surgery.
Yeah.
But I think with these newer, or more light even to the medical treatment side of weight loss, I think they're, the GLP medications, although they're not right for everybody, whether it's a barriers or a, side effects or whatever it is, at least it's bringing people to you to talk about it and being like, okay, well, we have these other 3 options we can try too. So.
And, all the options on a pill form are super affordable.
Right.
I mean, they're all less than like $20 a month.
Yeah, I have seen people get discouraged and just quit their, they're like, I tried
Their journey, yeah.
I tried whichever GLP medication, new one it is, insurance didn't pay for it. I can't pay $1,200 a month, and so I quit.
Yeah.
But you have other options.
Yeah, there are other options. And now, as of this year, both pharmaceutical companies that make these medications have cash pay options that are not $1,000 a month. So there are more, as time has gone by, there are more options.
Okay.
And also, we have to keep in mind there are multiple medications coming down the pipeline, and as those come out, I'm sure, hopefully, the prices of these other ones can come down. And I think I see a lot of people also get discouraged. It's like, oh, they don't have the latest medication, right? And, I always say this, we're not comparing an iPhone 5 to an 18, or I don't know what number they're at. They're 17, 16, 17.
I had to upgrade the other week, and so I know it's a 16.
All right, so we're not comparing an iPhone 2 to a 16. We're comparing a 14 to a 15 to a 16. They're all good.
Yeah.
You know.
It's what's the ultimate goal.
Yeah.
And that's just a healthier you.
Yeah.
Yeah. That was an excellent talk.
Oh, okay.
Anything else you want to add onto it?
No, I think also, there's social media has a lot of great things, but not, they have some negative things. And I think the unrealistic of expectations, like I see ads, because this is what I talk about all day, right?
Yeah.
So, the phone listens to you. I see ads. They're just, you don't even have to go to the gym if you take this medication. Like, you're doing a disservice to the people, or have these unrealistic expectations that I lost, like you said, I lost X amount of pounds and
Flashy thing. Yeah.
flashy. That's not, it's not real. It's not sustainable. And can someone have those results? Yes. It's not the majority, right? And it's not sustainable.
Yeah.
Yeah. So a lot of patients also initially, when they start a medication, they initially lose a little more weight than what they do, later on. And it's like, ideally a healthy rate of weight loss is half a pound to a pound per week. You shouldn't be losing more than that. If you lose more than that initially, it's kind of expected. A lot of that weight can be also water weight, especially if you're just recently changing your habits, your
Yeah.
eating habits. But the body will get used to it. And if you're losing half a pound to a pound per week, that is more than adequate.
And if you go more than that, higher chance of probably rebounding
Rebound,
because
not sustainable. Yeah.
it's just mentally and physically tough and
Yeah.
easier to break habit.
Yeah.
Or
I've been through that. I once worked
Yeah.
with a bodybuilding coach, and let me tell you that when he dropped my carbs to less than 100 a day, I completely lost it.
Yeah.
I lost it. I went to the supermarket at 9 p.m. and got a pack of Oreos.
Sounds
So yeah. So, and I learned, that my carbs in a day cannot be less than 150. Otherwise, it's gonna backfire.
Yeah.
Right. So.
Yeah. And that's a beautiful thing to continue to
Yeah.
learn more about yourself through these different methods that we talked about mainly in the first podcast
Yeah.
or the first episode. And we talked about the medication options and how to find somebody that might be a good prescriber, someone that specializes in it, because not all primary cares, I don't think, do the
Yeah.
weight loss medicine.
It requires a lot of time, right?
Everyone has their own, even in our own field, we have our own interests, whether it's
Yeah.
OB-GYN, menopause, endometriosis, and if your provider focuses on one or the other, it's hard to focus on other things. And so we have people like you who do this, and telehealth is very easy for your
Yes.
company. Inclusa Health, Google them, and you take some insurances,
Most.
most insurances. Which states do you have a license in?
I have licenses in Washington, California, Colorado, New York, Florida, Georgia, and Pennsylvania.
Wow.
Yeah.
That's a lot. So if
maybe soon Ohio and New Mexico.
Okay, great. And so if you want to just give Dr. Mercado's office a call and schedule an appointment consultation,
Yeah.
those are all of her states which she can help you in.
Yeah.
Anything else for a plug?
No.
Okay.
That's more than a plug.
Okay. Thank you, everyone.
All
Like
right.
the video, follow along. We'll get Dr. Mercado back here.
All right.
All right.
Bye.
Bye.
Till next time.
Till next time.